Okay, good day, everyone, and of course, welcome to the HR on the Go. Now, HR on the Go is a joint collaboration of Clark HR Council and CPHR Philippines, airing live on the CHRC Facebook page every other Tuesday. Now, of course, if you're looking to be featured, just send us an email at go@clarkhrcouncil.org. Now, of course, if you're also interested in becoming a CHRC member, just join us via www.clarkhrcouncil.org/join. No, of course, what are the member benefits of being a Clark HR Council member? Of course, why join CHRC? Of course, why join CHRC? Because you will also be getting some HR and labor updates. Of course, to stay on the top of HR and labor updates concerning the Clark Freeport Central Luzon and nationwide, access to the Ask HR, or an HR forum serving as collaboration and network platform for HR professionals. Now, you'll also be having an access to the Job Link portal. Now, the Job Link portal is a feature-rich job posting and applicant tracking platform with unlimited job posts and can manage, of course, unlimited candidates only for Clark HR's member, no? And apart from that, we also have member insights where we send and get a review of the updated insights on employer compliance, the labor market, Doble forms and guidelines, pay standards and practices per industry, wages and productivity benchmarking and report. Also, we'll also be providing HR templates. This is highly beneficial for startup companies, no? Na wala pang gaanong HR professionals sa kanilang workplaces. We also give HR templates. Now, share and download HR templates for every HR and employee situation. We also have a providers directory. So this providers directory gives you a list of HR vendors and service providers for every requirement. Now, for services or for service providers, no, we highlight also your brand to members. So even service providers can be a member of the Clark HR Council. Now, we also have an HR library, so continuously grow within access to full editions of HR-related ebooks. Now, from time to time, we also do our job fairs, get updates on upcoming job fairs, through our Clark HR Council Facebook page. So, at the moment, we don't have a job fair yet because we are in the lockdown, folks. So probably we might be doing an e-job fair. Now, we also have a weekly learning sessions, a free online live learning sessions on pressing HR and people management issues, not to led by Filipino industry leaders. So replays can also be watched through our clarkhrcouncil.org website, no, sa sa member section lang. And of course, we also do general membership meetings, so free attendance to general council meetings with representatives from government sectors to discuss updates. So previously, sa aming previous GMM, we had from Doble, the SSS, Pag-ibig, PhilHealth, etc. And of course, many more. So become a council member today. So again, to be a member, just visit our website at www.clarkhrcouncil.org/join. And of course, if you wish to know more about the council, just visit our website. So, wag na natin patagalin pa, and of course, this episode today, our 8th episode will be talking about the Omicron in the workplace, not just in the workplace, of course, but also in our household. Now, again, this Omicron in the workplace has indeed become and became another episode of our challenges and hardships. Now, as the COVID-19 pandemic approaches its 2-year anniversary, it's becoming painfully obvious that businesses must plan for ongoing outbreaks and new variants. Now, according to data provided by the Department of Health, the Philippines reported a record number of daily COVID-19 cases just yesterday, with over 30,000 new infections. Now, as of yesterday, January 17, there were actually 95 new active cases in Angeles City. Now, where the city have been placed to alert level 3 just last Sunday. So Omicron's quick spread emphasizes the need of having a plan in place. Now, of course, using real life examples and insights from our experienced guest, Dr. Maria Clemencita Dobles will help provide practical guidance on how to make sure you are prepared for any upcoming surges in your workplace. Now, before I introduce you to our speaker for today, no, can we add now Doc Menchi Dobles here in the session? Ayan, Doc Menchi, good day to you.
Um, Hello, good afternoon. Can you hear me?
Yes, Doc Menchi, can you hear me well?
Yes, ako okay lang. Is it
Yes, it's audible.
okay?
Ayan. Sige. Let me put you unmute. Okay, sige, mute muna tayo. Ayan, thank you very much, Doc Menchi, again for your time. Now, before tayo magsimula sa ating interview with Doc Menchi, which is actually very beneficial to Clark community members, no? Allow me to introduce our guest for today. So, Doc Menchi Dobles is actually a doctor of medicine, of course, and is also a certified family physician, occupational medicine, and also a fellow occupational medicine. Doc Dobles has also been in practice for more than 20 years, no? And she also became board of directors of various organizations, no, like Philippine College of Occupational National Office, Philippine Academy Family Physician, Angeles City Chapter, Philippine College of Occupational Medicine, Pampanga Chapter, and of course, Philippine Academy Family Physician, Angeles City Chapter. No, she has been with various organizations as well, as company physician, private practice, and also the manager, or a member of Clark Development Corporation since 2001, leading the organization and the Department of the Health and Sanitation Division as the manager. So without further ado, we will start now some few questions about Omicron in the workplace, because this will help us address yung ating mga facts and myths. A lot of myths have been spread throughout Facebook groups, websites, etc. na itong Omicron na to, ganito siya, etc. But through the help of Doc Menchi Dobles, matutulungan masagutan ito. Now, Doc Menchi, before we do that, I would like to ask you, kamusta ang January 2022, Doc Dobles, especially dyan sa CDC?
Well, sa Clark, Christmas was very quiet regarding cases of COVID. But as we went back to work, ayun, nag-start na sumabay si Omicron. So, we have a lot of cases now within Clark because it's already wide-scale community transmission. No? So, of course, maapektuhan yung mga pumapasok sa trabaho, maapektuhan yung kumpanya, no? So, we are enforcing strict compliance with the usual workplace protocols as provided by the Dole DTI guidelines ng Department of Health. Alam naman ng lahat yun. So, because we were able to conduct orientations several times on this through 2020 and 2021, no? But the protocols still remain, no, yung uh, distancing, face mask, and disinfection, and especially sa workplaces, yung mga manners, how they eat, hindi na pwedeng grupo. Kung pwede, wala nang smoking area because we have to remove the mask and things like that. They're still the same, no? But there are also some companies who adopted work arrangements. Like not everyone will be present in the same area, or maybe they adopted 50%. Some adopted even 30% of their workforce. But still, we have a high number of cases. We are compatible with the number of cases in the community and nationwide.
Right. Oh, and also we've been hearing rumors about, I'm not sure about the numbers, that the Omicron is 500 times no as contagious as the Alpha and Delta variant, no. So probably we can talk it about later kung talaga bang mas nakakahawa itong Omicron ngayon. And also we probably we can tackle some questions about meron na ba sa Pampanga na cases ng Omicron, or do we have any parang test na nagagamit na to trace if it's Omicron, or we can use the current mga swab test kit para ma-identify ito na as under COVID 19, no, na kung ano man variant ito. Now, Doc Menchi, no, now we would like to know, no, how vaccine mandates are now in force. Will there be fines, no, or are there any fines now for those companies that don't comply to ensure employee vaccination records are on hand? Are there also new policies from DOH and Dole concerning vaccination programs in the workplace that, of course, you would like to share, no, to help Clark leaders be informed and up to date, no, kasi previously parang last year and 2 years ago, no, talagang hindi natin fina-force yung employees na mag-take ng vaccination. It's like parang we encourage them, no, we recommend, but we do not really force them, or we do not want to use the strong word force, no, parang talagang encourage sila, no, na magpa-vaccine ngayon. So, with that in mind, Doc Menchi, no, how vaccine mandates are now enforced?
Okay. First and foremost, the latest IATF guidelines that I saw about unvaccinated people is that they have to, especially those who are working on site, they have to get tested RT-PCR, or if not available, the antigen test every 14 days. Just to This is to at least assure the company that this person is not infected. Uh, he or she is a person of interest because of he can be infected and he can get worse kasi hindi siya vaccinated, no? And so this means obviously vaccination is not mandatory. Okay, it's not mandatory. It's not compulsory. It is still via consent. It is still voluntary. So, but with all the awareness programs and awareness new in the news and all social media promoting awareness on the vaccination that can help a person be, if even if infected, can maybe not go through a severe case. These are things that we always say to people, we always impart to people so that they can be encouraged to get the vaccination. It's still not mandatory, no? We cannot force anyone to get vaccination if they don't want to. They have to come and request for vaccination. Okay, so uh, pero mind you, sa vaccination post namin, nung lumabas na yung, we are already, Jester, we are already in the Omicron stage. This is already Omicron, no? The government cannot test everyone if this is of Omicron because our laboratories cannot do that. And the program by WHO is that our test will be randomly checked. The RT-PCR positives will be randomly checked, and then for a percentage that they will meet. So that will already spell out that this is what is being transmitted right now is Omicron. And true enough, the government also disclosed that the uh, transmission of Omicron will be manifested by the doubling time. And our doubling time in transmission today is every 2 days, doubling time. So, kung kahapon 5, bukas 10 na yan. Ganon. So, ibig sabihin, doubling time na talaga. This is already Omicron. No? So, kung ilan yung Omicron na natetest will be random, hindi naman yun marami ang natetest. Kasi it takes time. Minsan, lalabas yung result ng test, tapos na yung quarantine ng patient. So, it's not, they don't test everyone na Omicron ba to o hindi. By the behavior sa community, this is already believed to be Omicron na.
Ayun, thank you for the information, Doc Dobles, no, that we are now in the new variant, no, because assuming that parang natapos na talaga yung alpha variant, no, and I believe delta din, no, so we are now in the phase of the new variant, and as what Doc Dobles have mentioned, no, mabilis magdoble, and we can even see the numbers not just sa ating City Information Office ng Angeles City, but even sa DOH, no, ang bilis ng number ng cases ng ating new variant now. Now that we are in this new phase, no, itong bagong variant na sobrang nakakahawa at mabilis ang paghawa nito, no. How is the CDC now encouraging companies in Clark to work remotely if they need to delay the return to office plans? Kasi previously, no, in our last episodes, actually, last December and November, I have talked to various professionals, no, and organization leaders, since pababa na, actually, ang bilis ng pagbaba ng numbers ng previous variant last year, ng November to December, and it seems like we are seeing the 2022 January, you know, a very good year to be back in the office. So HR managers have started to implement return to office work plans, no, sa bawat organizations nung December. But little did we know that binulagta tayo, no, ginulat tayo ng bagong variant na ito. Now, with that in mind, no, this new variant is actually rattling the return to workplace, no, so it is very imperative to know the contingency plans, which is of course crucial for dealing with the current stage. So is CTC encouraging Clark companies ba to work remotely if they need to? Doc Dobles?
Very variable kasi yung mga companies dito sa Clark. Iba-iba yung type of operation nila. Merong mga BPOs, manufacturing, di ba? So, that will depend on how feasible it is for a workplace to do that. No? But several workplaces we have seen that have already made adjustments, even engineering adjustments, no? Engineering controls na ginawa nila. Even yung mga dati nilang mga workplace na puno, ginagawa na nila yung konti lang ang pwedeng magtrabaho dito. And other companies also send their computers sa bahay. They also do that. No? Pero syempre sa mga iba limited yun. They cannot do that. It is still under the discretion of each workplace and how they do that. The Department of Labor also encourages that, but not to the point na hindi na mag-ooperate because our Filipinos need to work. No? Lalo na
Right.
ngayon, that's true, we are looking into a good 2020, but then eto si Omicron, ano? Naisip ko lang na sana kung gano'n siya kabilis dumating, sana gano'n din siya kabilis umalis, ano? Sana gano'n, no? So,
Correct.
ayun. So, it is still under discretion of any workplace on how to make work arrangement. If work from home works for them, then be it, nasa kanila yon. Yun na nga yung others would be able, like production, manufacturing. I don't think they would be able to do that kasi yung machines nasa sa manufacturing,
Correct,
no?
yeah.
They will just have to have strict marshals to implement the protocols na talagang behavioral na talagang babantayan nun.
Mhm. Doc Dobles, do you think ba the engineering controls placed last year, which is made to or designed for alpha variant, will still be parang effective pa rin ba so far, considering that we have a new variant, or kailangan mas stricter lang yung implementation niya, and the previous engineering controls so far would suffice naman na?
Well, I am not an engineer, but the Doble, Occupational Safety and Health Center, has also issued something about the ventilation. No? But they have to maybe recalibrate it if needed because of the behavior of Omicron. No? I don't know if it's still, maybe it's still effective yon, but
Mhm.
somehow, meron naman bagong dumating, pag-aaralan na naman, no? So,
Right.
baka they will need to, if needed, they might recalibrate these issuances.
Correct, yes. They can refer to the mga bagong labas ng mga DOLE policies, because we have been also reading some parang mga sinishare ng ating mga HR members from various group like HR Region 3, Dole Clark offices na nagsishare nga sila na they have installed ventilation system. So probably we can tackle that sa ating next speaker. No? So thank you, Doc Dobles. Now, following the DOH guidelines, so what changed in the isolation periods of the Omicron for employees, or not just employees, but even individuals no, who tested positive both for symptomatic and asymptomatic? So we've seen
Actually,
information na ano parang nag-shortened na yung isolation period, no? So can you help us guide, no, be guided dito sa ating bagong guidelines ng DOH about the isolation periods of the Omicron for employees, no, or individuals who tested positive?
yes. The new issuances on the updated guidelines on quarantine, isolation, and testing for case management of Omicron variant. Um, when I read it, I believe it is about more of taking care of those who have the COVID, have the case, or have the variant, because the health workers should be more focused on how to manage the case, because sa dami-dami, sa dinami-dami, the guidelines already discourages active contact tracing. That means the health workers should actively more focus on the patients, on how they are, than the contact tracing. Okay, it is already a wide scale community transmission. So contact tracing will be a little futile na. No, it's a futile exercise. It will be a futile exercise because um, sorry, because hindi mo na siya mahabol, no? May case tapos ito na yung
Ang
maraming
hirap ng i-trace.
contacts, no? Oo.
Mhm.
Tapos, hindi mo naman siya mahabol kaagad. So, ang focus ng guidelines is to really focus on the case management. How are
Mhm.
the cases? Kumusta yung mga pasyente? Hindi naman yan na kasi if we go focus on the contact tracing, mahahati na naman o kaya yung mga cases natin hindi sila matututukan. So even with the testing are no longer very much encouraged, but they are more prioritized for A1, 2, 3. So A1 is the health workers. We need to keep our health workers healthy, and by testing them, we will know kung sino talaga yung merong cases o wala, and how do we, and shorten din yung mga number of days nila of quarantine. And A2 is the seniors, A3 are those with comorbidities. We still can test others, but optional. Like if a case is going have a mild case, if a mild case is going through a moderate, pa-moderate na siya, I think we should test na also. So there are optional conditions why magte-test. Hindi na yan active testing. It will really exhaust so much resources, no? And it will exhaust our health workers kung yung contact tracing na napakalaking trabaho ay tututukan pa, mas importante matutukan yung mga pasyente.
Very correct. No, it's actually a very time killer. No, most especially if we are to trace back, no, from where it came from, because Omicron is very contagious. No, it may come, no, from various sources. No, I myself has been surrounded by positive individuals, no, na nahihirapan din sila mag-track, no, or mag-trace kung saan nanggaling. So I guess that's actually very true. No? It's very important for us to manage na lang the case, no. And of course, probably later on, no, the CDC would be helping us know, no, ano ba yung mga CDC health and sanitation programs sa Clark, now where the companies can benefit from. Now, following the DOH guidelines, no, yun na ang magandang dapat sundin natin. Now, apart from that, we've been in the phase of booster now, no, from last year, and I myself got my booster, no, I think this year lang, and then there's still new, no, na individuals na dumadating na naman, no, ang takot, no, sa booster. Previously, napakalaki, no, ng vaccine hesitation na because of various videos no being played no from various networks na pag nagpa-vaccine ka daw ito yung magiging adverse effects niya, probably pwede mo tong unfortunately ikamatay, etc. Pero natapos na yun by year 2020, at least by second, third and fourth quarter of the year, tumaas na no yung trust nila sa vaccine. But when dumating itong booster no, parang bumalik sa takot no ang mga tao. Now, we would like to know, especially coming from a medical profession like Doc mentioned, Dobles, no? How can we combat vaccine, no? Still vaccine and booster hesitation, and of course, how booster shots can help protect individuals from the Omicron variant. Doc Menchi?
Yes. Well, booster hesitation or vaccine hesitation per se, no, is truly difficult to combat. But basing on the numbers that we have now, no, majority and more than majority are already getting vaccinated. Very few na lang ang hindi. Um, we take time. We take time to talk to the unvaccinated. Ang objective lang ng isang health workers is to be able to say na yung person is already well informed. Ganun lang, informed. Still informed. Ang mahirap lang yung hindi mo na-inform yung unvaccinated. So we take time to inform yung mga unvaccinated. Yung mga kilala namin na unvaccinated, we discuss, converse with them, but not really forcing them to do that. Basta it's important that it is relayed to them ano yung advantage ng being vaccinated. At nasa kanila pa rin. As I said, hindi naman siya mandatory. With consent pa rin yan eh. Kahit magpapabaksin ka ngayon, pagpapimahan ka with consent, hindi ka naman ano. Pero, I have seen unvaccinated persons go into COVID then, no? And there were also reports na mostly yung mga na ICU at saka going through, yun yung mga unvaccinated. No? Meron number of nagsisevere din na merong mga unvaccinated din talaga, nasasabi yan sa mga government hospitals, naririnig ko lang yan. No, pero what's important is you have relayed kasi ang tao pa rin ang magde-decide eh.
Mm-hmm.
And also we seek the help of the companies. Pinapadalan din namin yung mga companies na mga videos, no, for them to show the employees na meron kasi yung DOH na video na kompleto siya, like FAQs, meron siyang ganon, para makita at marinig ng mga empleyado, yung mga questions sa isip-isip nila, kung ano yon. So, that's as far as we can go, is awareness lang and being able to tell them how it is.
Right, thank you for that, Doctor. No, speaking of awareness, no, I get yung ating manonood is it is very important no, for us to be vigilant no, about the various letters no or messages that have been circulated sa ating Facebook messages no. Now we strongly discourage no forwarding yung mga chains na ito coming from unreliable sources, because this will also just adds up to the anxiety of people no. Pwedeng totoo, pwedeng hindi, but of course we might still, it's better to go to reliable sources no. Kung meron man tayong napadalahan or na-receive, wag na natin itong forward unless it is from a reliable source no. You can check the City Information Office of your respective local government units, the DOH no, and from various no trustworthy sources no or institutions no, because dahil dito no mas parang lumalala pa yung pag-manage ng cases. Let's for example, ayaw na nilang magpa-booster kasi daw hindi naman daw nakakatulong dito dahil pang alpha variant lang daw to, na wala na daw effect itong mga vaccines na to because bagong variant na, etc. So unless the DOH no sinabi niya yon no, you follow, pero unless na hindi ito sinasabi ng DOH or any reliable source no, do not believe or forward these messages no to various people no. So kailangan natin mas tulungan no ang bawat isa no dito no. Going back to the previous topic, Doc, especially sa mga positive individuals no, let's talk about the antigen and RT-PCR swab. When is the best time to use, especially dito sa ating bagong variant, to use an antigen or an RT-PCR test, Doc, especially for both symptomatic and asymptomatic?
Um, we must remember that antigen is just for screening. It does not confirm. Okay? Pwedeng negative ka, tapos positive yung RT-PCR mo. No, pwede rin positive ka sa antigen tapos negative yung RT-PCR mo, 'di ba? But for it is best antigen is best used mga 3 to 5 days. Sometimes mas matagal pa nga eh kasi iba-iba yung variants. Sometimes it can reach up to 10 days bago magkaroon ng blood levels or levels sa katawan mo na maka-capture ng antigen testing o ng RT-PCR. So it's like kunwari may positive na nagkita kayo ngayon na ngayon pa lang, hindi mo naman siya kasama sa bahay. I don't think it's good to test today.
Mhm.
Okay? Kasi pwedeng magpalipas ka muna ng 3, 5 days. In fact, yung quarantine requirement nun sa mga arrivals is 5 days. 5 days after arrival, no? Although
Right.
ngayon wala nang quarantine sa mga green countries. So,
Mhm.
hindi naman siya right away. But if you were with the person for several days na, pwede na magpa-antigen din o RT-PCR. Um, as I said, the government is uh, already stated that there's a new guideline sa testing. Mas magandang matest yung mga comorbidities, health workers, and seniors, no? So that they can be, matututukan sila ng husto because they need special care. No? They need special care. Kaya sila yung tututukan. I'm sure for one it's because sobrang maubos tayo ng resources kapag lahat magte-test pa sa bilis ng Omicron ngayon, sa bilis ng pagtaas, no? That's very expensive na for the country and for the stakeholders.
Right, right. Now, Doktor, meron kasi tayong mga employees and individuals din na parang hindi sila napapakali no kapag hindi nila alam yung result. Now, for those who tested positive and then wala naman symptoms na lumabas and then of course asymptomatic sila, do you recommend or do you think that it's best to test again sa mga positive na lumipas na yung kanilang quarantine period or isolation period? Do you think lilitaw pa rin ba yung positive result pero hindi na siya nakakahawa or pwede naman siyang mag-show ng negative result na after the isolation period sa mga nag-positive previously?
Actually, viruses per se have this property. They don't really stay long in our body, no? So, magte-test ka ng magte-test ka for this certain type of virus, let's say COVID, yes, for a number of times, hindi na yon reliable na may COVID, may virus ka pa rin or may COVID ka pa rin kasi may remnants, di ba? So, ang testing actually can help in just identifying. But if we have this wide-scale community transmission, ah, pag meron ka ng symptoms and you think you have been to a place na pwedeng nakakuha ka like the groceries o yung mga namamalengke or nagwo-work every day or nagpunta ka somewhere else or lalo na in December, maraming na-identify nag-positive yung mga New Year's party, ganon, no? So, you are already a probable case. No? If you are already a probable case, you consider yourself already a probable case. The same naman ang treatment eh. So, parang bakit ka pa magte-test? 'Di ba? Isolate ka na, quarantine ka na, and then tell the one who you were with na, I have this symptom na. You have to watch, baka meron din kayo, gano'n, no? So, and then you just have to finish the number of days. Tapos na yon. Okay? But then you have to see a doctor or call a doctor, call somebody to help you on with your symptoms, no? So the testing is already parang hindi na masyadong ganyan yung testing ngayon kasi doubling time every 2 days. So pag meron ka, parang ay, yun na rin yun. Then if
Mhm.
it's not, it's just the same. If it's not, pareho lang naman na treatment. Kung flu yan, flu yan. But yung manifestations mo, meron naman specific symptoms, yun na rin yun. So yun ang ine-encourage ngayon ng government actually. Which is I think is practical. practical for the Philippines, no? And also practical for the companies. Para hindi na sila gumastos sa testing. Kasi yung iba gusto pa nila RT-PCR, which is very expensive talaga
Mhm.
for, okay, so yung mga ganun. Did I answer your question?
Yes, yes, Doktora, no?
Okay.
Especially pag natapos na yung mga isolation period ng positive na, I think it's not really recommended to test out
No
again.
need. No need to be tested again. The requirement is, like for example, yung mga nagkaroon ng symptoms. Let's say, nag-test siya or hindi siya nag-test. 7 days yan. 7 days quarantine, no? Yung mild, no? Siyempre, mas mahaba para sa moderate and severe. Severe will be 21 days, okay? So, if 7 days, tatapos na, you just have to have about 1 to 2 days na walang symptom before that day. Kunwari, nagka-symptom ka ng day 1. So, day 7, tapos na. Pero may symptom ka pa ba? Kung may symptom ka pa, extend pa yun. Pero kung wala na, you can go back tomorrow sa work mo. You can go back tomorrow. That's what we're doing now for
Mhm.
the locators and for our employees also in CDC.
Ayun, no? Thank you very much, Doc Dobles, no? I think that
Oo.
answered, no, the questions of the Angileños, no? Now, to end, no, yung ating interview today, no? Of course, now we would like to ask, no, what is the best guide to combat Omicron in the workplace and of course, no, at home, no? Doc Menchi?
Yes, at home, in the workplace, no, in the workplace, always wear your mask, no. Make sure you are at a distance sa mga co-workers mo. And in the workplace, one important thing is walang papasok na may symptoms. Okay, dapat walang papasok na may symptoms. So, kasi kung merong pumasok, like for example, may pumasok na may symptoms, ah tapos ano, naka-shuttle siya o kaya naka-carpool. So, automatic yung sa carpool niya or naka-shuttle, close contacts na yon,
Right.
no? Tapos papasok pa siya sa office niya. So, madami na naman yon, no?
Mhm.
So, ang department kung nasaan siya o kaya yung mga ibang departments na kasama niya sa carpool na hindi niya ka-department, maapektuhan din. So one of the best thing is not to go to work pag may symptom ka. And then report to your company doctor or report to your attending physician. Kasi para you will be taken care of. Okay.
Mhm. Kahit gaano pa kaliit na symptom 'yan, no, do not try, no, going to public places. How about Doctor at home? How do we combat the Omicron at home?
Uh, for for our homes, no, we have to check our members parate. Ask them, may symptoms ka ba? Wala. Lalo na yung mga nagtatrabaho. Lahat tayo sa bahay, minsan wala nang matitira sa umaga kasi nagtatrabaho, no. Yung mga nag-aaral, nandun naman sila, no, kasi wala pang face-to-face ngayon, pero pwedeng maapektuhan yon. And we have to also practice disinfection. Disinfection is very important. We have to, one important thing is pag may symptom ka na, which is rare practice ngayon, sabihin mo na kagad. No, minsan nangangati na lamunan. Omicron pa naman, minsan meron yan, nag-uumpisa as headache, no? Ang hirap,
Right.
kasi bino mo headache,
Mhm.
yung iba nag-uumpisa as headache. So, medyo mahirap talaga. Pero, we just have to do what we have to do. We have to keep ourselves clean, healthy, kasi and well nourished, kasi po para sa doctors and health workers, alam namin ito na ang pagkain ay laban, no? So a poorly nourished body really will poorly combat also what will come. Also drink lots of water, kasi yung hydration is very important for the body temperature, no? And the body temperature, kapag hindi siya masyadong mainit because of your water intake, ayaw ng virus yun. No, para kasing incubator ka kapag mainit eh. So, talagang inaalagaan mo. Also, keep your windows open. You have to have a very well ventilated house or room, no? Ayun. And also, syempre, exercise. And siguro, if you're smoking, you have to think about it. Mga ganon. Oo.
Yun, thank you so much, Doktora, no, yung
Ah,
mga maliliit.
meron pa
Mhm.
pala, sorry. You have to prepare an isolation room sa bahay.
May
Kasi yun yung
designated
advice
talaga.
na, yeah, meron designate
Mhm.
na kayong isolation room sa bahay. Kahit na may gumagamit ngayon, pero once na meron kayong parang may symptoms, yun na yung
Mhm.
gagamitin. And preferably, meron siyang sariling banyo. Meron
Mhm.
din mga cases na wala silang sariling banyo pero konti lang sila. They make way. They make
Mhm.
some board up. Parang meron silang mga gagawing mga harang na upuan o ito sa
Mhm.
CR na to, ito lang gagamit, ganun, ganun.
Mhm.
So, sometimes you can improvise, but make sure
Mhm.
it all leads to the prevention of transmission.
Yun. Thank you very much, Doc Menchi. Now, of course, to end our interview, no, would you like to share, no, some health and sanitation programs Clark companies can benefit from? And of course, you may want also to share, no, the vaccine and booster schedule in Clark. And of course, meron din mga Clark companies nagtatanong, no, how they can do, no, employee on-site vaccination. Doc Menchi?
Okay. Um, because of the pandemic, some of our programs were not able to meet our targets for the year last year. No, but we are still encouraging uh, locators for these programs, especially um, not really known to everybody. Mataas pa rin ang HIV sa Philippines, no? So we have this program for locators that they can be we can still have yung programs for awareness sa HIV, also for tuberculosis kasi worldwide number 7 pa rin ng Philippines sa tuberculosis, which is not good, no? And yung age group na natatamaan nito is working age group. So this is a very important program for the workplace. Also, we have, if you want to have an online awareness program for this, aside from COVID, of course, as part of your health and safety committee activities, uh, you can always call us. Also, the PhilPen is we enroll companies to identify hypertensive, diabetes, yung mga non-communicable diseases. Andyan pa, and we have to really take care of these patients kasi sila yung may comorbids, no? So we have enrolled locators and we hope to have more locators to be enrolled in this. We can provide medicines daily through the PhilPen program of the Department of Health. No? Merong mga naka-enroll nito. Also, we have kaya lang this January hindi matutuloy. We also facilitate trainings na hindi nila makukuha sa labas or para
Mhm.
dito na lang sa Clark, like yung mga first aid trainings na
Mhm.
requirement for the emergency contingency plan of each locator kasi each workplace kailangan meron siyang emergency program, no?
Right.
So we facilitate this also. Kung nung walang COVID, we do this about 8 to 10 times a year, no?
Mhm.
But nagka-COVID, face to face kasi to kasi
Mhm.
online ay ano to talaga kailangan
Besides siya
training
sa
talaga.
face-to-face.
Yes, oo. And also, uh, for tomorrow, no,
Mhm.
tomorrow we had the Department of Health Region 3 has granted us tomorrow, has given us a speaker, Dr. Aida Felix, to talk about the updated guidelines on isolation, quarantine, and testing for Omicron. No? So that
Mhm.
will be 10 o'clock. We have, if you will check, for Clark locators, if you will check your email, kung yun pa rin ang email, no, please check your email. We have sent already the invitation. Meron pong yan na Zoom link. Meron na pong Zoom link yan. What do you call that? IDN passcode or something, no?
Mhm.
So, meron na po yan. So, and for vaccination schedule, we last year because of the Bayanihan Bakunahan, we were able to come up with inviting walk-ins kahit na sino, ganon, no? Because we have this commercial, remember, sa parade ground. So,
Right.
we made a stall, yung stall doon, isang stall doon ng commercial, hiniram namin. So, ang daming nagpabakuna noon. But then, for this month, we want to focus on Clark locators. So, we want all locators to be given the booster and we are reserving yung mga vaccines namin for them, no? But we cannot allow walk-in na hindi scheduled because of the Omicron. Bakit? Kasi when
Pag walk-in lang, anybody, any locate or any employee, hindi namin alam
Correct.
kung close contact siya eh.
Mhm.
'Di ba? Kung close contact siya ba o baka may symptoms siya, hindi namin alam. But when the
Mhm.
company sends the names to us, o ito na yung mga pangalan,
Control.
doktora, hindi sila
Mhm.
wala pa dito yung close contact, later na lang sila, mga ganon. So, at
Mhm.
least nahihimay, tsaka protected yung mga employees na dumarating sa vaccination post. So, we schedule them. Hanggang February po, may schedule na.
Mhm.
I will flash dito po yung email address and the contact number of the Clark Vaccination Post for you to send
Mhm.
to us kung gusto nyong magpa-schedule, and then we'll find the schedule for you.
Mhm.
For larger companies, such as meron kayong 500, ganon, we send a mobile team. Meron kaming vaccination team. Aside from the vaccination post center, no, merong vaccination team, we send it to you kapag schedule mo. Sa site mo, sa mismong locator, magpa-vaccine kami doon. We will just have to check and coordinate about paano yung setup. That will be easy, di ba? Pero para hindi na pupunta sa vaccination post sa Clark Polytech yung mga locators, we send the vaccination team. That is the mobile team. So last week we started with sending mobile vaccination teams while we are still doing the vaccination at the vaccination post in Clark Polytech. So we are really we want to all those who had first and second dose, we want them to get boosted too. And priority pa rin po yung mga first dose. Kung meron pa rin po hindi nakakapag first dose, priority pa rin po namin yon, syempre. No, baka meron na kayong na convince. To tell you the truth, nung lumabas na Omicron na to, January 3, 4, 5, no? In a day, meron kaming 150 na first dose. So, ang dami pa rin unvaccinated siguro, no? Kasi ang dami nagpapa-first dose sa amin, eh. No? So, yun. And we want to prioritize also your employees who are senior and with comorbids. Yun pa rin. Okay? So, last year, we were able to prioritize health workers, yung mga company doctors, company nurses, no? So, nakapag-booster na po. Baka meron pang hindi, we still prioritize them. So, I will flash now. May I flash? Jester, can I flash this
Yeah,
one?
sure, Doc. Sige, you
Slides.
can click the share screen
Paano kasi to?
beside the cam or mic dito sa ating StreamYard. Click
Okay.
the share screen and then click the share screen again. And then lilitaw ulit yung window na share screen.
Ito.
Mhm.
Wala. Ba't kaya wala? Window.
Yes,
Ayun.
correct.
I got
Window,
it.
tama. Ayun.
I got it.
Ako, dami nating information nakuha ngayon kay
Eto.
Dr. Menchie. Ayan, I can see your screen now.
Can you see it
Alright.
now? Yan, I enlarge.
Yan.
Maybe can take a picture of it. Ito yung number and the email address for Clark Vaccination Post.
Ayun. So take a screenshot now, Clark Vaccination Post. Doctor, probably can also share your Facebook pages where they can get updates and information about sa mga services and information. Doc?
Hindi ko memorize. Sorry. But we have meron sa Clark Development Corporation, we always post there, no? We always post there sa Clark Development Corporation. Meron po sa Facebook 'yon.
Ayun. So, Clark Vaccination Post, no? CVC COVID, vac@gmail.com or just send a message, no? 0961-541-1881. Ayun.
Okay. Jester, this is to also emphasize that this is primarily for Clark locators. Okay.
Okay, no, to our dear audience, no, especially sa mga natuwang services ng Clark, no, this is for Clark Locator. So if you're not a member yet, no, you can be a member of the Clark Locators. No, I think you can message Sila or Clark Investors Locators Group, or I think meron mga various organizations na pwede nyo kontakin para maging isang locator sa Clark. So, ayun. So, I guess that sums up our interview for today, Doc Menchie, no? So, again, no, the emergence of the Omicron variant, no, of COVID-19 has dived the hopes that, of course, the pandemic will soon fade away. But, of course, soon, no, it will still fade away, no? Basta, no, panatiliin natin na to encourage the vaccination of our employees, to consider local transmission, no? Of course, yung mga policies, no, dun sa ating mga return to the office decisions, we have to reduce the exposure through social distancing and improve ventilation, and probably Doc Menchi, baka meron kang isang pinaka, no, reminder sa ating viewers, no, especially in this new phase of variant Omicron.
Yes, of course, I would like to tell everyone that we can combat this, no? Wag po tayong mawala ng pag-asa, no? Because everybody's working on this, hindi lang tayo, yung buong mundo, no? And a lot of people are helping also for our countries to move on, our country to move on. We are really looking forward for yung dati na family tayo, pupunta tayo sa ibang lugar, no? And let us pray that we can reach this by as soon as possible, no? Let us keep praying also, but let us keep ourselves informed, and let us keep ourselves let us have courage every time and believe that there's something more to this. Thank you.
Ayun, no? Thank you, Doc Menchi, no? So again, no, don't just wait for help, but also help others, no, through yung binigay na tips, no, ni Dr. Menchi Doble. So with that, again, no, thank you everyone. Thank you again, Doc Menchi, for your time. Bye for now, Doc Menchi. Okay. All right. Now, of course, no, again, visit our Facebook page, no, and watch our episodes again, no, sa ating Clark HR Council or CPHR Philippines. Again, if you're interested in becoming a CHRC member, join us via clarkhrcouncil.org/join, or of course, if you're looking to be featured, just send us an email at go@clarkhrcouncil.org. So with that, no, this sums up our online show for today, and we hope to see you in our next episode. So bye and be safe, everyone. Bye.